Hello everyone, welcome to our podcast Health Matters, and today we have with us someone very special. We have Dr. Mir Jawad Zar Khan, who's a senior orthopedic surgeon. He's done thousands of knee replacements, he's done several thousands of orthopedic surgeries and has treated many patients, and we are fortunate to have him with us today. So Dr. Mir, I would like to start by asking that, what has been your experience like? What made you choose this field? And you've worked in Germany, India extensively. So what has it been like for you?
First of all, thank you, Kalpana, for calling me here for this health talk on Times Now.
Our pleasure.
I'm delighted to be here today. So I like to share my experience today with the Times Now. Basically, my parents are doctors, so my father is also orthopedic. So from the childhood, it's my passion to be in this field. So I always liked the anatomy, and so I have been studying my father doing surgery. So that is like from the beginning I had a passion for this field. So that's the reason I joined this field. And so I have been fortunate enough to have my training in Germany in joint replacement in reputed world-class institutes there. So basically I am a joint replacement surgeon. I do robotic surgeries as well as arthroscopic surgeries.
Okay.
I have my hospital, Germanten Hospitals now, is established with the German precision technology, with the equipment we share with Germany. So we are now expanding into multiple branches in Hyderabad, Telangana and other states.
Okay.
So we have been treating a lot of patients and we are getting very excellent results. So basically we treat a variety of orthopedic conditions.
Okay.
Not only trauma, but we do complicated joint replacements, complicated fractures, spine surgery, sports injuries. So me and my orthopedic team, we cater to a wide variety of patients. So we offer a lot of world-class treatments here in Hyderabad, and we also have a lot of international patients visiting us here. So we have very excellent results, and our passion is to bring mobility to people and bring smiles to their faces.
That's a brilliant message. In fact, that's what I was going to ask next, that, ortho, this field that you've chosen, I mean, there are complications and there are a number of cases that are going up every year. Would you like to talk to us about that?
Yes, we have seen the tremendous rise in orthopedic problem over the years, and most of this we contribute to the lifestyle. So now most of the people, for example, the software professionals, they are like, most of them have a sedentary lifestyle. They are mostly sitting over the laptop or doing their work. They hardly have any exercise. So if you see, a lot of muscle weakness will develop with that thing. Not only that, even the knee weakness. So the spine problems are very common now. Even arthritis has become very common.
Right.
So the most common causes of arthritis, we can say, are previously, previous generations, the knees used to be very good, even at 90 years. Now we see patients as young as 40 years coming with knee pains. So this is unfortunate that most of the cause is due to the sedentary lifestyle, dietary habits, and it contributes a long way in this kind of problems. So no doubt arthritis as such has genetic factors, but contributing factors like lack of exercise, diet, and all these things go a long way. And also neglecting any sports injuries, prior ligament injuries, that too also lead to early arthritis. And then if they have any medical conditions like rheumatoid arthritis, they too contribute to arthritis. So basically one need to be aware of the condition, and early diagnosis definitely plays a lot of role in this.
So what are some of the symptoms, early symptoms that you see people tend to miss, and by the time they come to you, it's already at an advanced stage?
So basically the early symptoms of knee are like mild pain, stiffness in the knee joint. You feel when you wake up you're having some stiffness in the knee joint, or your knee is swollen. So this kind of symptoms if you're getting, it's better to seek an orthopedic opinion as soon as possible to recognize what is the cause and do a proper measure of the lifestyle changes, or any condition to be diagnosed early definitely has a long way in making that condition not to progress. So like that, if you are experiencing back pain in an early stage, you can, if you consult a doctor, he may advise you some tests like a simple X-ray can also be very helpful. And if you are having any suppose signs of a slip disc, maybe a early physio rehab or you're strengthening your back exercise or as simple as changing your office chair goes a long way in not letting that into becoming a big problem. And once it is treated earlier and you follow a proper biomechanics of the spine, so you are you will not land up with gross things. But if it's neglected, it may even go up to surgery. So we need to avoid it in the early stages.
We just spoke about, you mentioned that, things that people can do to avoid surgeries. Something that, I mean, you must have experienced it yourself, that there's a lot of distrust in knee replacement surgeries. Patients really want to understand that, is there any alternative? Can they really, go about their life without any surgery?
Correct.
What do you say to them?
It's a good question. Like every day in my practice, I see hundreds of patients, everybody suffering and asking the similar question. And we offer, actually, surgery is not always the answer. So knee replacement, I don't believe that everybody needs knee replacement as such. It too has its own complications. Basically, knee replacement is for people who are having advanced arthritis or grade 4 and any bowing of the knees. So it is for them. And in myself, in my own practice, up to grade 3 osteoarthritis, I treat with a variety of non-operative methods, and we have very excellent results. Like if this patient is suffering from early knee, so we ask them to undergo proper rehab, lifestyle changes like avoiding stairs, avoiding squatting. This goes a long way in making your cartilage. Ultimate arthritis is due to cartilage wear and tear.
Right.
So if you are taking a proper precaution, like you are avoiding stairs, you are not squatting and doing regular exercise, if you start exercises, so most of the time this arthritis get arrested and it doesn't progress and you tend to lead a healthy lifestyle. But suppose the patient comes with a little bit few months pain and having grade 2 osteoarthritis, and then we have like glucosamine tablets for them. Apart from that, we also have so many therapies now. Like we are now offering some advanced therapies like genicular artery embolization, a recently introduced concept. So this is also working very nicely, where we embolize the artery, where the knee has maximum inflammatory effect. So this also is a very long effect. At the same time, we are having now like cartilage transplant surgeries. This is minimally invasive, not like knee replacement. So we do a nanoscopy, and we, wherever the cartilage is damaged, we put a contour filler or artificial cartilage. We have cartilage transplant. Even we are having the cartilage growth cells or even stem cells have shown results. No doubt it is a clinical stage, but there's a lot of patients who still benefiting from the stem cell therapy. When the body has natural stem cells as a natural growth, they have a natural what you call as growth factors in them. When we properly harness this power of them, we can have that cartilage to be grown back. So this is one thing. And then we have the viscose supplementations which were there from almost decades. So this is another therapy. So there is like radio frequency therapy. So there are innumerable therapies nowadays available. So no need for the patient to immediately jump for surgery. So it all depends on the judgment of the treating orthopedic doctor, orthopedician. So he can diagnose like which treatment is suitable for you. Like as simple as a physiotherapy, as simple as doing some exercises can also cure your joint, and avoiding stairs also can cure your joint. Suppose if your pain is very severe, you are coming from few months or years, no tablets working for you, no exercise working for you, then we can do the stem cell therapy or this genicular artery embolization. We do that also in my hospital. It requires a very like a cath lab kind of facility. So this is also a daycare procedure. Patient just can walk and go away in just 6 hours after this. So no need for any admission in this. So at the same time, we do a lot of combination procedures, and along with that, lifestyle changes. So I have seen a lot of patients benefit with this therapy and become pain free, and they are doing excellently from many years. So in fact, we are avoiding surgeries to many people. So unless they are in grade 4, we don't. And if once they are grade 4, then we are having robotic knee replacements available with us. so which is have a lot of advantage over traditional knee replacement.
Yeah.
And very early mobility, like fast daycare surgeries we are doing.
Okay.
So orthopedic has seen a tremendous advancement in the recent years, and as at my hospital, which is Germanten Hospitals, we are following lot of technologies, and definitely lot of patients are benefiting from us.
Doctor, this sounds really exciting. I would love to know, since you treat patients overseas as well, are there any technology, something that we Indians can look forward to, something that you can be bringing to India?
Yeah, we have almost, India has a lot of technologies on par of US and Germany, and we have a special collaboration with Germany, my hospital.
Okay.
So we are actually doing a lot of musculoskeletal research and in stem cells, cartilage transplants, which are like not like the traditional knee replacement, but we are doing, now the trend is towards minimally invasive surgery.
Right.
Not only in knee but also in spine, like where endoscopy and laser surgeries. The trend has changed. People don't want a very big incisions.
Right.
So even we do hip replacement with anterior approach, which has very minimal incisions. This requires very minimal incision techniques. Like even nowadays we are using AI and robotics. So much advancement we have seen,
Yeah.
and we are always, it's good to follow the technology. So as far as robotic, which we are doing, this also has a lot of improvements in accuracy in the knee replacement, early mobility, avoiding damage to the ligaments, and very with minimal bone cut and faster surgery.
Okay.
So all this has very huge benefit to the patient. But ultimately, awareness is important, that everybody need to be aware and take care of their knees and spine. This all happens by a proper awareness. So ultimately, prevention is better than cure. Right?
Yeah. So before we end this podcast, I would love for you to tell our audience that, what are those 5 things that everyone should do, young, adults, elderly, that can protect their knees and bones?
To summarize in 5 things is a little difficult, but still I can tell. First thing is regular exercise. Please do regular exercise. If you are sitting, suppose you are having a software job where you have to sit for hours together, please in 1 hour just get up and do some spine exercise, knee exercise. That goes a long way. Make it a habit of that. The second thing is have a proper sunlight. So that is very important for your bones.
Vitamin D. Yeah.
And your healthy diet. So now the trend is towards protein diet. So as we in India, like we are more for carb diet, but nowadays the trend is changing towards protein diet. So this is like change in dietary habits also go a long way. Your fresh air and more important is need a proper sleep and stress-free life. So not only for your bones and knee, but it is equally important for your heart and all
Absolutely.
your body.
Yes. Thank you so much, and I'm sure you have so much to take away from this conversation, nuggets of information that can keep you healthy and safe. Thank you. Thank you, Doctor, for joining us.
Thank you for inviting me.
Thank you.
Right.